Hello everyone, my name is Sahan and Safi and I'd like to welcome you to DxTx. So this is this channel's first episode, and just to start I thought I'd give you a little bit of an introduction in terms of what this channel is going to be all about. To start, I can talk about a little bit about myself. So I'm a PA in emergency medicine in downtown Toronto. I've been working as a PA over the last 5 years. For those of you who may not be familiar with PAs are often known as physician assistants, physician associates. They're very well established professionals down in the United States, rather new in the Canadian healthcare system, and we function as physician extenders. So we work in a medical model to extend the scope of the physicians whom we work with. We can function in pretty much any medical specialty that has physicians who need an extra hand to help provide more care to the patients that they serve. And so in my role in emergency medicine over the last 5 years, I've had a lot of exposure to a variety of different patient populations, and I've realized that over the years there's a little bit of a gap in our system in terms of providing patients with adequate medical information online. So that's why I've started this channel. Especially over the last month, I've run into so many patients who come into our emergency department saying, you know, I've had these symptoms. I ask why they came to the emergency department for those symptoms, and they say, you know, well, I Googled it. I looked it up on a particular website and it told me that I might have cancer, or I think that, you know, I have brain cancer, or that I have a kidney infection and that I might need to be admitted to hospital. And it's somewhat surprising how off a lot of the times the information that they've received are, and how misled these patients are, and how distraught it makes them when they come to the emergency department just to be told that they're safe to go home, that there's no signs of any emergent conditions. So really, it's going to give you a sneak peek into the mind of a clinician, and is going to hopefully guide you in terms of dealing with some common issues that often arise in people. It will have initially probably a bit more of a focus on things that we often see in the emergency department that probably doesn't need to be seen in the emergency department. But at the end of the day, I'm going to be open to your feedback. I'm looking forward to making this an interactive channel and really catering my videos to questions that you guys have going into the future. As with all information that you guys will find online, both on the internet as well as on YouTube, I just want to give you a word of caution that this channel is strictly meant for informational purposes and really to just give you guys the perspective of what we think of when we approach a certain problem as clinicians. If you do have any particular medical concerns that you are worried about, we always encourage you to make sure that you touch base with a qualified medical provider so that you get an adequate assessment and a reasonable diagnosis in a reasonable amount of time. Thank you very much, and I look forward to seeing you next week at DxTx.